Good morning, everyone. It's Dr. Charlotte Hodges, and I wanted to do just a little quick video on post-operative pain, when to be concerned and when not to. So all of our patients undergo laparoscopic surgery. That means you just get tiny incisions. And by undergoing laparoscopic surgery, that really helps with post-operative pain and post-operative recovery. And actually, it also substantially decreases your risk for having complications after surgery. So every one of my surgeries are always done laparoscopically. And to be quite honest, I don't think I've had to dig out a book Walter. That's the retractor when you're doing an open surgery. Oh my God, in several years. So if I ever have to dig that thing out, that means no bueno. So whenever you have surgery, there is going to be pain involved. And we try to do several different things to mitigate this pain. Ooh, they're redoing the streets, so it might get a little noisy, so I might stop talking. Preoperatively, in the pre-op holding, we will sometimes do a block on the abdomen, abdominal wall, to help decrease issues with pain. Sorry. And of course, post-operatively, while you're in the hospital, you will be receiving medication, some non-opioid, some opioid. Oh my goodness, sorry. To help you with the pain. What are some of the best things you can do to help relieve this pain? Number one, walking is going to be your absolute best friend. And then also, if you haven't had a bowel movement in a couple of days after surgery, make sure that you start to take some stool softeners, Miralax, Colace. I also will give my patients a prescription for Crystallose, which is also the generic form is Lactulose. Because if you have not had a bowel movement in several days and you're starting to get constipated, that's also going to contribute to some of these feelings of being really bloated in pain, especially in the upper portion of your abdomen. Now, for my patients, the incision that is right above your belly button, that is always my camera incision, and I'm moving that camera all around. So it's not uncommon for that incision to hurt more than the others. For my sleeve patients, the largest incision is on the right. For bypass and duodenal switch patients or revisional patients, the largest incision is on the left. That is in the incision that I dilate up. I put stitches in your abdominal wall. And so you will have much more pain, and it's a musculoskeletal pain at those incisions. It is not uncommon for you 2 or 3 days after surgery for your whole belly to feel a lot better, and then you to have much more localized pain on either the right or left side. You can even have pain that kind of radiates around to your back. You'll notice it when you cough, sneeze, laugh, hiccup, because you're causing some increased intra-abdominal pressure. You're causing those muscles to contract. Woo! Lots of traffic, you won't be able to hear me. It will cause those muscles to contract, and you'll have pain. That is normal post-operative pain. If you're still having a lot of pain your first week after surgery, I'll sometimes prescribe you a muscle relaxer over a narcotic to help you with some of that musculoskeletal pain. Some of the common calls that I'll get after surgery is you've increased your activity and it kind of feels like something's pulling or tearing, or your pain was okay, it was going away, but now it's coming back. I will tell you 9 times out of 10, after I discuss with you the activities that you've been doing, I'll find that your pain is normal post-operative pain, and I'm not concerned. When should you be concerned? Every day you should be improving, little bits at a time. If you find that you have a persistent dull pain in your left upper quadrant, or if you have a cough, shortness of breath, give the office a call because you may need to be reevaluated. I'm also going to be doing a video on what normal incisions look like and when to be concerned about infection and when not to. But for the most part, patients are going to do well. I have a pretty low threshold for performing radiographic evaluations after surgery, just to clear the air. Just because I send you to go get a CT does not necessarily mean that there's an infection or a bleed or an abscess or even a leak. Because the reality is that the risk for bleeding infection is less than 5%. The risk for leak is less than 1%. And so odds are you're just fine. It's just that you're having some postoperative pain, and don't feel bad. Everybody has a different threshold for their pain level. So I hope that you guys have found this helpful. I hope that this has kind of quelled some of your fears. The vast majority of the time, the pain that you're feeling is going to be normal postoperative pain. However, by all means, if you have any questions, give the office a call. Listen to your body. If it just doesn't feel right, I want to be able to see you. I want to make sure that things are going okay. So hope that this has been helpful for y'all. Give me a thumbs up and don't forget to subscribe. Oh, and share this with your friends if they've had surgery too and they're concerned. Bye.